Clemencia Solorzano, and she's a pharmacist and one of the founders of Pulse People for Patient Safety that have been meeting since 2014. Clemencia is a pharmacist, and we are celebrating Pharmacy Week this week, October 18th to 24th, 2020. And in recognition of Pharmacy Week, we invited Clemencia to come and talk to us about being a pharmacist, some of the things that we should know from a pharmacist, medication trials. We'll talk about medications in the hospital and preparing your medication list, which is part of the Take Charge campaign. So I'm going to ask Dr. Solorzano some questions, and we hope that we can spur some dialogue and conversation for future presentations and conversations with pharmacists and with your community pharmacists. You may want to think about wishing them a happy Pharmacy Week this week during October. So welcome, Dr. Solorzano.
Thank you, Eileen.
So I want to start off with just asking you a little bit about you, because I've always been curious, what makes somebody want to be a pharmacist? Is this something you started out wanting as a little girl? What makes somebody want to do this?
Well, for me, this was never a dream. It's basically serendipity why I ended up being a pharmacist. And my steps to becoming a pharmacist was, it was really one thing leading to another, and I ended up here. Serendipity. I started off being graduating with a biology degree. My first job was in research, but that was with animals, looking at adrenals in a pediatric neurology lab. And then after 2 years, I decided that, I needed a profession, needed to do something else. And so I started to look around, where would my credits as a biology major, fit in without having to start all over again. And pharmacy was one of those professions that I could use 2 years of credits and go into pharmacy school. And that's what I did.
So is there a lot of schooling behind being a pharmacist?
Absolutely. So my journey was really not the current journey for most pharmacists that they take. Right now, when you go into school for pharmacy, you finish high school. If you have good grades, you can go straight into a pharmacy track, but that's 6 years of schooling to finish school with a doctorate degree. If you don't have, if you didn't go into school right away, you can get a biology degree and then apply to, or any type of undergraduate degree and then apply to pharmacy school. So that journey would be a little bit longer because you've done 4 years of an undergrad degree, and then you'll have to go in to pharmacy school and finish however many years, depending on how many credits they accept, how many years it would take to finish that PharmD program. So it could be anywhere from 4 to maybe 5 years in addition. For those people who already have a biology degree or another science degree and they're going into pharmacy school, you can get a pharmacy degree, which is a bachelor's degree for most of the people who went to school a long time ago for pharmacy, and then go back to school for a 2-year degree to PharmD degree to get your doctorate. So that was basically my path. I had an undergraduate degree, I went to pharmacy school, and then I went back several years later to get my PharmD degree. It takes at least 6 years if you go straight, and it can take anywhere for 7, 8, 9 years.
So when we go to the pharmacist, the local pharmacy, we could assume that the person behind the counter mixing our medications, have they all had that training and that schooling? Is that something
Yes.
everybody has had?
Yes. Yes. Cool. Pharmacy schools are expected that the student will go through that 6 years of training. Their final year in school is their clinical year, and that's where they get on the, do the rounds with the doctors and get very intimately involved in making therapeutic suggestions and reviewing orders and that sort of thing.
So you're saying the pharmacist is the one that makes the therapeutic suggestions, meaning that they recommend the medication for a patient?
In hospitals, a pharmacist do round with, on some units, pharmacists are an integral part of the hospital treatment staff, clinical staff, and they will be with the doctor while those decisions are being made. And so if they're working up a patient with a certain disease state, the pharmacist will actually be asked sometimes, okay, so which drugs do we have in the hospital and which one would be best for this patient?
And what happens in the doctor's office then? If they have all this help in the hospital, when you get to a doctor's office, it's a different setup. Then there's no pharmacy there or pharmacist
Right.
there.
So in the doctor's office, the doctor is the one making that decision as to what the disease state is and what drugs they will be using to treat that patient. The pharmacist is involved when the prescription gets written and it goes to a community pharmacy, and that's where that relationship,
And
the order gets reviewed.
And can the community pharmacist question a doctor's decision on medication? Do they ever do that?
Yes, because sometimes when prescriptions are unclearly written, or if somehow in speaking with the patient, you get an idea that sometimes you have to ask the patient why they're getting this medication. And once you start asking questions further, sometimes you realize as a pharmacist that maybe this isn't the drug that was meant to be ordered. So it's a lot of critical thinking when you see that prescription. Sometimes you look at the age of the patient and you say, well, maybe this is not quite what the doctor intended to do. So you make a call to the doctor and clarify the prescription.
Pharmacist really is a tool to keep an error from reaching us if the doctor happens to make a mistake with medication.
Yes.
That's good to know. So where you are right now as a pharmacist, is there a next step? What happens? What's the chain of moving up in your position or where you are now? What happens after you're a pharmacist? Is there levels or?
So in pharmacy, you can move up. It depends on what your goals are. So you can go from being a staff pharmacist to being a manager or a supervisor or a director, and that's all up to you if that's what you want to do. Most of the time, pharmacists, there's so many opportunities there that as you start practicing, you develop liking for a certain field or a certain area of practice, and then you basically get into a specialized role and transfer to that particular area. So a lot of times it requires more education and practice in that area in order to move into these specialized areas. Specialized areas are like, to work with oncology patients, cancer patients, or pediatric patients. That requires some different type of skill. And once you get into that particular area, if that's what you want to do, and then you can work your way up within that area. Everywhere is different. And so, yes, there are always ways to move up and move around and get new skills.
Clemencia, we hear about medication errors are a big problem in patient safety. It's one of the biggest problems that we have heard about. What are some of the errors that you've seen, or where errors happen that we need to think about as patients when we become patients or preparing to become a well-prepared patient? What are some of the errors that are most common? Do you have any thoughts on that?
Sure. Most common errors are look-alike, sound-alike errors, where medications The name of a medication could be very similar to another medication name, hydralazine, hydroxyzine. And for pharmacy, we make sure that those medications are separated by a different shelf, and we have different lettering for those medications, the naming of those medications, for us not to make a mistake. On the other hand, patients who get medications and they have them in bottles at home, we need to find ways of tagging those prescription bottles differently, because sometimes the medications are similar in appearance, and so it gets to be really sticky. If you take all your medications and put it in a pill box, you may not know exactly which one of those pills, the name of the pills that you're referring to. So you could be taking a blood pressure pill when really you need an ulcer medication, just because they look alike. So it's really important to keep them separate. That's one of the things. So we have look alike and we have sound alike. Those are very very common errors, and we've taken steps to try to make sure that everybody's aware that this is an error that can easily happen. Other types of errors that you would probably see would be prescribing errors. That's also very similar sounding names. A drug that is used to treat Crohn's disease sounds like a drug that's used for a bacterial infection. Sulfasalazine versus sulfadiazine, and depending on what the physician is doing at the time, he knows both medications and could just get a little bit confused in which one. So sometimes we have to go back to the patient's diagnosis to make sure that it's the right medication. So prescribing errors can happen like that. And then duplicate therapies is a big part of medication errors, because sometimes patients go to very different physicians for different problems, and they may be prescribed a similar medication or the same class of medication from each of those physicians, and now they're taking duplicate medication for the same problem, and that leads to side effects. And so that's another very common
So I'm thinking the look-alike, sound-alike problem. If I go to my doctor tells me that he's prescribing a medication, or she's prescribing a medication, I should write it down in longhand, what they're saying, and then make sure it matches what I get. Just because if it goes to the pharmacy and the pharmacy writes something else on my prescription, I want to make sure it says exactly what the doctor prescribed.
Absolutely. And for most clinic visits, you will get an actual typewritten summary of what happened in the clinic visit with what the new prescriptions are added. And if you keep that paper, you should be able to refer to it when the pharmacist gives you that medication. You should be able to look at it and to make sure that the letters match, the words are the same.
What's the difference between your medication errors and medication interactions? What's an interaction?
An interaction involves at least two medications or multiple medications. And what that means is that either the medication may interact prior to administration. So in a hospital, we may make an IV drug, and if we put two medications together, we could actually have an incompatibility. That's one medication interaction. There's another medication interaction when the patient gets the prescription and starts taking it and they're on other medications. It could interact with the other medications that they're on, and you may have either an increased side effect such as sleepiness or nausea, or it could be any side effect actually. And the medications, so that's an example of interaction,
All right, well, we're going to close for tonight, and we're going to finish this round 1 with talking with Dr. Clemencia Solorzano, and we will be back tomorrow with some more information. Please join us again tomorrow. Look for this video on our Facebook page and LinkedIn and wherever you do your social media. We'll be back. Thank you.